I'm Nancy Hanna, Physician Assistant at Clark Just for Women Health Solutions, and I'm part of the bone team at Clark Memorial Health. Today I'd like to talk to you about your bone health. I'll explain osteoporosis and its causes, and I'll help you learn how you can prevent fractures. Osteoporosis is a condition in which the bones become thin and brittle, and they have a higher risk of fracture. Osteopenia refers to bone loss that is not quite as severe, but there's still increased risk. The statistics about osteoporosis are staggering. 1/2 of all women and 1/4 of all men will fracture a bone due to osteoporosis. There are 2 million fractures each year due to bone loss. These are highly preventable. We know that 1/4 of all the people who break their hip will die within a year. 1/2 of the people who break their hip will never go home again to a normal life. This affects not only the patient, but the extended family. Sometimes adult children have to quit their jobs to help take care of mom or dad. And there's a huge financial burden if you have to go to a nursing home or assisted living. My goal is to help you prevent fracture and to keep your independence as long as possible. Every day, bone cells called osteoclasts remove old bone and make room for new bone. And other bone-building cells called osteoblasts build new bone. This is called remodeling, and it occurs constantly. In fact, every few years we get a whole new skeleton. When women reach menopause and we lose our estrogen, then the osteoclasts are much more powerful than the osteoblasts, and so we have a net bone loss. This is what osteoporosis looks like. You can see the thinning and the broken pieces of bone. Normal bone is much thicker and denser and has decreased risk of fracture. This bone loss occurs in men as well, but a couple of decades later. We diagnose osteoporosis by using non-invasive bone density tests, one of which is called a DEXA scan. The results of a DEXA scan are reported in numbers called T-scores. The T-scores are very small numbers, so tiny changes up or down can be significant. This chart shows the T-scores from a DEXA scan. Normal levels are better than -1. Osteopenia is between -1 and -2.5, and scores that are at -2.5 or worse represent osteoporosis. This test is usually done every other year because changes in the scores take a long time to occur. Women should be screened at least by age 65. Men should all be screened by at least age 70 or sooner if they have risk factors. When we review your DEXA scan, we'll go over some risk factors and see which ones you have. Risk factors for osteoporosis include low bone density, low body weight, family history of fractures or a previous fracture, smoking, sedentary lifestyle, 3 or more alcoholic drinks per day, long-term use of steroids and some medications. Calcium intake is extremely important. Current guidelines suggest that women should take 1,200 milligrams of calcium per day. The best way to get your calcium is through your diet for better absorption and for less constipation. You'll be given a list of calcium foods to see if you can improve your intake. If you can't get enough through your diet, there are multiple types of supplements that can be taken. Most of them come in 500 or 600 milligrams per serving because that's the most we can absorb at a time. There are several different types of calcium that you can get. There are calcium pills that come in 600 milligrams. These are pretty big, so sometimes people will take a supplement that's got petites, and there will be 2 of them will equal a serving of 600 milligrams. There are gummies, which are very tasty, and 2 of them is always a serving. There are also chewables that are chocolate and caramel flavor. One very important thing, though, is to read the back of the bottle. Read how many pills is a serving, and read whether you should take it with food or not. If it says take it with food, then you have to take it for absorption purposes. It doesn't cause a stomach ache, but it won't get absorbed right if you don't take it correctly. If it says take it with or without food, then any time of the day is okay. Just remember to divide your doses if you're going to get all of your calcium through supplements. You can also get calcium from dairy foods and non-dairy foods such as almond milk that have been fortified with calcium. To read how much calcium is in your dairy foods, be sure to look at the side panel. It will show you the ingredients, look down for the vitamins and look at calcium, and it'll have a percentage there. For that serving size, which is at the top, it'll have a certain percentage of calcium. In this almond milk, it has 45%. In order to see how many milligrams are in this, you would have to add a 0 to that 45%, and you know that there are 450 milligrams in there. So anytime you pick up an item that has a percent of calcium, just add a 0 to that, and you'll know how many milligrams you have, so that you can plan your daily intake accordingly. It is possible to get too much calcium. It can cause kidney stones and calcium deposits in the blood vessels if you take too much. So we want to get a sufficient amount, but not too much. Vitamin D is also very important. A vitamin D level can be tested as a simple blood test. Normal levels are between 30 and 100, but for bone health, kidney health, and colon health, we think that optimal levels may be between 40 and 60. Most dairy products are fortified with vitamin D, and most of the calcium supplements that you take will have extra vitamin D in them as well. We think most people need about 1,000 to 2,000 units a day. They're called units instead of milligrams. IUs are how they're presented. Most of them come in a small gel cap, and there may be a microgram written on the front of the bottle, but right next to it, it'll have the international units. And over the counter, you can get 1,000, 2,000, 4,000, and 5,000 units. These should just be taken once a day. They can be taken with or without food, but again, read the label on the bottle to tell you whether it should be taken with food. The gel caps are very small, no matter what the dose is, so they're easy to swallow. You can get too much vitamin D. However, it's pretty hard to do so. Fall prevention is also very important. Make sure you have a night light on if you get up to go to the bathroom at night. Don't have throw rugs that are loose and could trip you. Don't have shoes poking out from under the bed. Use handrails wherever you need them, and put up a grab bar in the bathroom for exiting the bathtub or shower. Have a long-handled grasper available for if you drop something on the floor, you can reach down and grab it, and then you don't have to bend over and risk a fall. If you have balance problems or dizziness issues, be sure to touch something when you first stand up. Hold on for a few seconds before you start to walk, and that'll decrease your risk of falls. Exercise is very important. Exercise can make your bones stronger and your muscles stronger. Weight-bearing exercise includes walking, elliptical, yoga, and treadmills. Anything that is standing is weight-bearing. Resistance exercises can also build muscle. Those would include using exercise bands. You can do this while you're sitting and watching television. Bands can be pulled and stretched. Some of them are very easy to pull, others are very hard to pull. And if you turn your hands over, it helps you exercise other muscles. You can get extra long bands and put them under your feet, and then when you pull up on them, you get exercise for these muscles. And if you turn your hands over and pull up, then you exercise these muscles. We know that if you keep strong bones and strong muscles, it can help you catch yourself when you fall. And strong muscles give you extra padding to prevent a fracture if you fall. This is one of the most important things to remember. The day you can't get out of your chair any longer on your own is the day you lose your independence. When your provider reviews your DEXA scores and your risk factors, we'll decide which type of medication might be best for you. There are several different types of medications. There are daily, weekly, monthly pills. There is an IV that can be given once a year at the hospital, and there is an injection that we give in the office once every 6 months. There is another pen injector that you give yourself once a day for 2 years. It takes about 1 minute once a day to give this injection with a very tiny needle. There is another medication that we give as injections where you take an injection in each arm 1 time a month for 12 months. And after any of these medications, you may be put on another medication to help maintain the bone that you've built. Your provider will discuss your T-scores with you and will help you decide which medication, if any, is appropriate for you. Thank you for listening. I hope I've given you some information that can help you improve your bone health. Remember that our main goal is to decrease the disability that comes from fragility fractures and to keep you independent as long as possible.